Hello, everyone. Welcome to the Project Dermeath podcast. Today, we're excited to have Amy Lee join us. Amy is a senior data engineer at CVS Health, where she works at the intersection of data, AI, and healthcare to solve complex problems and improve patient experiences. We're excited to hear more about her journey, her work in technology, and her insights on future AI in healthcare. Amy, thank you so much for being here today. Whenever you're ready, are you ready to move on to the questions? For some reason, we can't hear you properly.
Okay, can you hear me now?
Yes, perfect. Okay, so for the first question, can you walk us through a little bit on your journey from going from working at a cancer institute to becoming a data scientist and now a data engineer at CVS Health? And what are some key moments that pushed you to go towards AI driven work?
That's a good question. So I actually joined Dana-Farber right after college. At the time, I just knew I wanted to work in healthcare, but didn't know what that entailed. Only knew about, certain roles like physician, nurse, etc. But there are actually a lot more than that. So that's how I joined into healthcare operations. Started there, went on for many years. And just talking with patients, working with providers, working behind the scenes on how a hospital works. That really got me very interested in technology because at that time, it was when EMRs started, when all the like digital health and all of that was being discussed, being used, and there were a lot of questions about, how can we use this technology to make things more efficient, but then also from a patient perspective, like how can I use this to better my own health? And so all of this kind of culminated to me getting interested in tech. And at the time, I was also interested in data, and so that kind of got me exploring, got me into data science. I want to say a very key moment was me just joining a hackathon one day. Where I got to see all the different roles: data scientists, engineers, physicians, etc., just coming together to work on creating these products. And and then I was like, you know what? Let me just try this journey. So that's how I got into did a bit more schooling and then got into data science, and then into CVS Health, I guess, as a data engineer. That was they kind of just like followed along that track.
Very cool. Okay, that's really amazing. So, okay, for the second question, so at CVS, so what does it look like to deploy like an idea or is like some a solution for an idea? And then how do you actually deploy it in like a real healthcare environment, even though it has like real constraints? And what are some of those constraints?
Yeah, so I think any project's about the same. You go through your planning phases, you go through understanding who your users will be, but also as with any tech type of product, we have to worry about infrastructure. We have to have all those environments set up before we even deploy the product where it's going to live from now on. So I want to say that it's a mix. So from like regular project management, also just like the regular like technology, from start to finish in terms of deploying a product. And then the piece that is key for healthcare though is that we have a lot of focus on obviously privacy, security, all of that. And I mean now that's actually expanded to a big focus in general in any space, but healthcare has always been very concerned about that, and that's I wouldn't say a constraint, but I would say like it's definitely like something that we is like on the list of things we always have to check. Just making sure whatever we're deploying is going to be secure. It's going to be if there's data involved, it's going to be following the right compliance standards, and all of that as well, and making sure it's robust. Any product that you want to deploy is always going to be able to withstand some hits to it.
Makes me really happy to hear just because I work for like Snapchat's digital council and we work to basically employ like safety for teenagers and it's nice to hear like companies still caring about our privacy. I think that's really important.
Yeah, yeah,
Okay,
definitely.
for the third question. So, what do you see AI currently falling short in healthcare systems like CVS's and what needs to be solved before it becomes like safe and or meaningfully scaled? Hey, Amy, I think you're cutting off a little. I think your screen's freezing.
So, so for this third question, I want to say that, hmm, it's a good question. So I want to say that I think AI is still being very much explored in this space. Really knowing like
Mhm.
where is it that we can fully utilize it to its most potential, but then also making sure that we are still keeping the standards that we've always had. I want to say that I wouldn't. I don't know if there's anything like necessarily falling short, but that we are um, making sure that we're taking like a step by step approach to make sure that we are trying to be innovative with AI, but at the same time, like AI is not like a cure all. So you still need to make sure that you're checking everything, validating the data that's coming through from AI is correct, making sure that the processes and systems in place are there so that you're making sure that whatever data comes through is still governed. It's still like the system itself is still like compliant with, anything that we want to make sure that nothing's falling through. So I think I think those are the pieces where, as we tighten it more, we'll be able to use AI to be, scaled more and all of that. I think also the other thing is since we're still exploring, there's still new things that we're learning about what AI can do and all of that. Um, as we learn more about it, I think that's where we can, continue to leverage it more for any solution to solve any problems.
Makes sense, for sure. I feel like AI is still being so explored and it's still such we know so much, yet we know so little. It's so interesting. And especially how it's definitely progressing and it's evolving so fast. Like I feel like ChatGPT, like if you used ChatGPT a couple years ago, it's not the same anymore. Or like these new chat boxes, like for example, like Claude. Claude's really good at coding and everything. And I feel like it's so revolutionary to see that. And like following up, like another follow up question. So, where do you see AI in healthcare heading in the next like 5 to 10ish years? Were you able to hear that?
No, I'm sorry. I think my connection
No
is a
worries.
little.
Yeah. So, what I said was, where do you see AI in healthcare heading in the next like 5 to 10ish years?
So I think a lot of things that are happening right now are things that are going to continue for the next couple of years. I think, for example, like digital health is very big right now with wearables, with apps, etc. And I think that that's being augmented with AI as well. People are trying to find ways in which in the apps you have an AI assistant who can help you explain what the results are that you are seeing, whether it's results coming from your physician or it's coming from just like your device that you're wearing. I think the other thing is that we are already trying to use AI to make things more efficient for healthcare operations and administrative stuff because one of the biggest issues within healthcare has always been paperwork, has always been administrative stuff. And so AI has been used to try to streamline those processes more. And I think that's going to continue because there's just so much processes in healthcare. And so I think that's going to continue. I think infrastructure security that's been an increasing focus, and I think that's going to continue on because cybersecurity is such a big thing, especially in the age of AI, just in general, but also especially in healthcare. And I think probably just like innovation. We're still exploring. We're going to probably continue exploring. New things come out in the tech field. We're going to try to pull that into healthcare, see if that works, not works. And also safety and compliance is going to continue being a huge thing going forward for the next couple of years because it's there's already work in it, but there's more work to be done for it, and so that's going to
That
continue.
totally makes sense, for sure. And then the very last question. So, what advice would you give students who want to enter tech, but they don't always see people like them represented in their fields, like as an Asian American woman in STEM?
Um,
Amy, can you hear me possibly?
Give me 1 second.
Okay, yeah. Now I can hear you. So, were you able to hear the question, or I can repeat it?
I think I know what the last question was. I think I heard part of it. In terms of advice for someone trying to get into tech, right? For students or who are interested in going into tech.
And then
So
also as like a people like as people of color who aren't represented in their fields, like as an Asian American woman in STEM.
yeah, yeah. So I think in general, like a saying comes into mind is like if you have a will, it'll like happen. If there's a will, there's a way, kind of thing. So I want to say that one of the first advice I would give is make sure you really like tech. Make sure you really like, tech or even just like the niche healthcare tech or et cetera, because I think it's only when you're passionate about it, that you're curious about it, and continue to leverage that kind of like passion and curiosity to keep exploring, keep learning, et cetera. Because anyone who goes into tech is gonna have to like look up the information themselves, gonna have to learn on their own, and just seek out the information on their own. And it's only if you really like it that you're gonna really pursue it. And that's just for healthcare in general, actually. I've seen people kind of stop, in that career track just because they're like, I actually don't really like it because I thought that it was going to be this way, but it's actually another way. So I want to say, keep with that, find that passion. Keep with that, keep a goal in mind, actually. The field's very big, actually. You're not going to like everything in it, but if you know what it is specifically that made you like this field, just kind of keep up with that, and that's going to help anyone, I guess, get in. um, Talk to people, keep and be open-minded, because as you talk with more people, you will get a lot of different ideas, uh, and be able to like help bolster your own ideas as well. And you'll also realize like, oh, hey, I didn't know that exists, and that actually might end up being that new track that you want to go into, or that niche that I go into. And this is just probably like a general advice I want to say, but yeah, I think in tech is the same thing. I think for in terms of for not seeing a lot of um, lot of people like 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 them being represented in the field itself and how that goes in with getting into the field. Um, Personally, I think, just ignore it, in the sense that like focus on what your goal is. If you like something, just go for it. It doesn't matter if there's not a lot of people in it. Yes, it's a journey going to be hard. I won't deny that. Is it going to be like you're going to have a lot of blockers? You're going to have a lot of questions. You're not sure who you can ask. I'll be honest, I didn't even know engineering existed before I went into college. And so that's so, so it's only after I graduated and after I've seen other people go into the field, who I, knew, that I was like, oh, hey, this actually existed. Okay, cool. This actually is very interesting. Um, and so that's what I mean by like just talk to a lot of people. If you're shy, which I was actually before, so I don't really like to like talk to people. But once you realize like in the field, there's no judgment. I mean, there might be judgment for some people. You can ignore those people. Just like if you like what you do, or at least like where it's going, just go for it and just don't pay attention to what people are thinking, because I think one thing, especially in tech too, is like everyone tells me this too, is like just focus on the skills and the knowledge that you build for yourself, because that will contribute to the confidence you'll have as you go somewhere. And it's not so much of like how people look at you, it's just more of like you yourself just focus on your own skills and development, and only compare yourself to the person right before you learned a new skill, or the person that right before you learn new knowledge. And that will build your confidence and just, continue on that track.
I think that's phenomenal advice, honestly. I think that's all that matters, focusing on your passions and focusing on talking to people to understand. I think that's phenomenal advice. And those are my very last questions. Thank you so much for making an appearance on the show. I really appreciate you taking the time in and talking about it because it was truly invaluable, the advice you provided. But thank you so much.
Thank you for having
All
me.
right, so
Thank you so much.
yeah, all right. Thank you so much. That was wraps, but until next time. Thank you.
Thank you.